Today, we're sitting down with someone who's had a powerful impact on the direction and growth of the National Ovarian Cancer Coalition. Dr. Meredith Mitstifer recently wrapped up her term as board chair, and she's here to reflect on her leadership journey and the community she's helped shape and what comes next. Meredith, it's great to have you here.
Thank you for having me.
So let's go back to the beginning. What inspired you to get involved with NOCC?
Well, I think it was my first experience with the organization itself being a survivor. I had friends that brought me to a run walk, which is now together in Teal. And despite maybe a little resistance on my part, I quickly felt so comfortable in that environment and listened to other survivor stories and felt so empowered to begin to share my own. So I credit that Together in Teal moment and just being in a place where I felt connected and understood with really not having to say anything.
So your term as board chair spanned 6 years.
Yes,
You saw a lot of changes,
I
some
did.
expected and some unexpected. Talk to me about some of the moments that stand out to you when you look back on your term.
I think what stands out definitely the most are just the people, right? The stories, the friendships, the connections, the leadership, the changes in leadership, the staff. I think, it's one thing when you meet someone that is compassionate, but when you meet people that are compassionate about a disease that you yourself have been through and you see all they are doing to move the needle in research, to move the needle in support, to include caregivers, I think that had the greatest impact on me, let alone the number of programs and resources that definitely evolved under that time frame was just magical. I have no better word for it. And I think as a survivor and looking at it through that lens, it makes me speechless. It makes me proud, incredibly honored, and definitely was the best volunteer gig I have ever had.
And one of the things that happened during your term was, of course, COVID.
Ah, yes.
So during that time, talk to me about the shift that you saw in the NOCC and the organization and how we were able to pivot during a very unexpected and unprecedented time.
Absolutely. Cancer is traumatic enough, let alone I can't imagine being diagnosed during that time, having to face treatment, surgeries, life-changing decisions without support because limitations were presented in care facilities or hospitals. Treatment was done maybe alone. It had to be frightening given everything had turned virtual and virtual platforms. People that were in rural areas could get help and support. We were able to offer so many programs and resources in terms of food, not just for the survivor, but for the caregiver and or family member. And then something that I find incredible is the financial assistance program, because not only were you facing a cancer diagnosis that changes so many things, now you have COVID and now you have a financial strain. So that financial assistance program, I think, is just something I am just so proud of this organization for creating and supporting and and taking care of my sisters.
And it was a turning point for NOCC in a lot of ways during that time.
Yeah, we realized that we were gonna keep a lot of those programs even after COVID because of how crucial they were. So it just opened up so many more doors and windows for them that we knew that we couldn't stop, and we also didn't stop building more for the time we're in now, so
I've heard you talk a lot about connection and community. When you think back on your term, what are some of the people or groups or moments that stand out to you the most?
I've shared this before in a meeting, but I'll never forget. It was a walk, a Together in Teal moment in Boston, and everyone had finished the walk, and we were starting to kind of take down tents, and that's when the rain hit. And I will never forget watching this survivor fall to her knees and just look up at the sky and embrace the rain and be so grateful, proud, accomplished for finishing the walk, but also just feeling safe enough to do that in that space was monumental for me. I knew that I was supporting a phenomenal organization that provided these outlets for people in need, and for me too. I mean, they did it for me, so I'm grateful to be able to pass it along and do more for others that follow me, and hopefully to a point where we don't face this disease in the same way in the future.
And so let's talk about what's next for you. You are not leaving
Oh,
NOCC. What will you be
never.
what will you be doing during this transition time as we bring on a new chair?
Well, first, I have to say that I welcome and embrace change. And, my term was up. And while I'm definitely a little sad, I am not going anywhere because NOCC is my lifeline. And not only do I feel that they've been so good to me, they've been so good to so many people. So I'm not going to stop doing what I'm doing. I just maybe have a few less meetings to go to, and that's okay. But I'll remain on the board for a year and continue to embrace Team Teal. I love being part of that endurance platform and challenging myself and hopefully raising more awareness as well as raising hope for other survivors. You're stuck with me. I'm not going anywhere.
Thank goodness. So, if someone's listening today and they're interested in getting involved, they want to volunteer, or they want to maybe join the board, what advice would you have for them?
Well, first, I would want to tell them that NOCC is definitely a place where education, advocacy, and compassion meet. And so there's no better place to volunteer, donate, and or become more involved even at a board level if you have some super mad skills that we could definitely benefit from. We'd be more than happy to have you join us and continue to help make a difference in the lives of those facing this horrible disease.
Well, Meredith, we're so grateful for you and your leadership, and we're appreciative that you took the time to speak with us today. Your service and your vision have changed us for the better, and we just are so glad to be on this journey with you.
Thank you so much, LA. I have to say that NOCC has done the same for me, and they totally fill my cup.